Hello everyone, today we will discuss bioavailability, one of the important pharmacokinetic parameter which is very commonly asked in MBBS paper as well as in NEET PG, especially the numerical part which is related to it. I will be discussing all that and I am Dr. Meenakshi Gupta from the Conceptual Pharmacology channel. If you like my video, please subscribe my channel and put up your valuable suggestion in the comment box. Let's get started with the topic bioavailability. So bioavailability, what is that? So few words they are there which tells its meaning by itself. So the word here is bioavailability. So this bioavailability, if we split it into two, bio and availability. Now we can define it. What is bioavailability? Means how much drug is available biologically. आपके पास कितनी ड्रग है जो काम कर सकती है, और इन अदर वर्ड वी कैन से हाउ मच ड्रग विल बी present in the systemic circulation, right? So if the bioavailability is more, अगर ये आपकी bioavailability ज़्यादा है, that means drug action will be more. If the bioavailability is less, that means less amount of the drug is there and less action will be produced. Now, that means the bioavailability is not in 100%. It is less than that. When is it 100% and when it is less than that, right? It is not in 100%, it is less than that. That means a fraction of given dose of drug is available in the systemic circulation. So पहली definition आपको क्या बताई? Bioavailability हम उसको split कर देते हैं how much drug is available biologically. अब मैंने क्या बताया? इसका मतलब ये है कि उसका एक fraction है वो available है, not the 100%. Now the question comes, this is a fraction of the administered dose of the drug that reaches the systemic circulation in the unchanged form. That is the definition of the bioavailability. Why it is not available 100% and when is it not available 100%? So I will tell first, it is available 100% only if you give a drug by IV route. Rest of the routes, whether it is oral, subcutaneous, intradermal, इंट्रामस्कुलर, रेक्टल, अपार्ट फ्रॉम द आईवी रूट, ये वाले रूट को छोड़ के आप किसी और रूट से भी देते हो, इट इज ऑलवेज इट विल बी लेस देन 100%. इट मे बी नियर टू 100%, इट मे बी 99%, बट नेवर एवर इट विल बी 100%. So it is a route. If you are giving a route apart from the IV route, then what will happen? The bioavailability is not 100%. But why it is so? अब हम इसको लेंगे why it is so. ऐसे क्यों है ये, ऐसे क्यों है, why? So just look at the next picture. So as you all know, here this diagram shows the person has taken 100 milligram of the drug orally. So if the person takes the 100 milligram of the drug orally, so this is the small intestine. As you all know, maximum absorption, see, maximum absorption of any drug happens where? In the small intestine. So person has taken 100 milligram of the drug, then this is the systemic circulation. आपकी कितनी आई है systemic circulation में? Only 20 milligram. 100 milligram आपने दिया है, you have given the 100 milligram, और कितनी आई है आपकी? 20 milligram of the drug that comes into the systemic circulation. Now where that 80 milligram, where it is gone? See, the maximum absorption of the drug, it happens into the स्मॉल इंटेस्टाइन. और स्मॉल इंटेस्टाइन में बेटा कैसे ड्रग एब्जॉर्ब होती है? स्मॉल इंटेस्टाइन में द ड्रग इट इज एब्जॉर्ब्ड थ्रू द पोर्टल वेन एंड वेयर इट गोज टू द लिवर. यहाँ से स्मॉल इंटेस्टाइन से ड्रग एब्जॉर्ब होगी पोर्टल वेन में, और पोर्टल वेन से इट विल गो इनटू द लिवर. right? Now what happens in the liver? Now how much it is absorbed from the small intestine first? We have taken the 100% has taken 100 milligram. With the 100 milligram, it is only the 80 milligram that is absorbed through the portal vein, and where it is gone, it is gone into the liver. That means the 20% of the drug that is not absorbed. 20 milligram, sorry, 20 milligram of the drug that is not absorbed. So why it is not 100%? Number one is incomplete absorption. It is not absorbed when you are giving a drug by any other route, especially if you are giving it by oral route. The 20 milligram of the drug that is not at all absorbed. So incomplete absorption that is there. And now 80 milligram which is absorbed in the liver. Now what happens in the liver? In the liver, it undergoes a metabolism with the help of enzyme cytochrome P450, right? Then it is going to move into the systemic circulation. So it's not simple, I have simplified. Otherwise, from the liver it goes into the hepatic veins, from the hepatic veins to the right side of the heart, from there to the lung, then to the left side of the heart, then from the aorta it moves into the systemic circulation. So isko yahan pe ye cut short kiya hua hai is diagram mein. Now the metabolism which happens in the liver, it is called first pass metabolism. Because we say why it is named as first pass metabolism, because the drug before going into the systemic circulation it has to pass through the liver first. ठीक है, सिस्टेमिक सर्कुलेशन में जाने से पहले ड्रग को पहले लिवर से पास करना पड़ेगा. दैट्स व्हाई इट इज कॉल्ड द फर्स्ट पास मेटाबॉलिज्म. और अनदर वर्ड इसको हम ये भी बोलते हैं प्री सिस्टेमिक मेटाबॉलिज्म, ये भी कहते हैं इसको प्री सिस्टेमिक मेटाबॉलिज्म, राइट? तो दोनों में से कोई भी टर्म. दिस इज अनदर शॉर्ट नोट, इंपॉर्टेंट शॉर्ट नोट विच इज वेरी कॉमनली आस्क्ड इन exam, so I will not touch right now. So but at least इतना आपको पता लग गया होगा कि what is the first pass metabolism. First pass metabolism is before reaching a drug into systemic circulation, it undergoes a metabolism within the liver. अब liver में जब metabolism हुई with the 80 milligram, what happens? It's 60 milligram it is metabolized. 80 में से 60 क्या हो गया आपका मेटाबोलाइज हो गया. अब कितना बचा आपके पास? 20. So now the second factor, important factor is, what is the second important factor? Second important factor here is first pass metabolism. So first was incomplete absorption. So first important, why it is not available 100% if you are giving it by oral route or any other route. The first thing is it is not completely absorbed. So incomplete absorption, that is the first factor. And the second one is pre-systemic metabolism or first pass metabolism. ये बिल्कुल नहीं भूलना है. These are the two important factors which affects the bioavailability of the drug: incomplete absorption and the first pass metabolism. ठीक है? Now, can we calculate the bioavailability of any drug? Yes, we can calculate the bioavailability of any drug by drawing plasma concentration versus time curve. ठीक है? Okay. We will take time on the x-axis and plasma concentration on the y-axis. This side it is time and this side it is a plasma concentration. I have written a PC. PC stands for the plasma concentration. So you know at the zero time, जब भी आप कोई भी drug देते हो, ठीक है, at the zero time the plasma concentration it is zero. Slowly what happens? The concentration it increases. धीरे 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 ये बढ़ती है and it reaches a peak value and then all of a sudden it gets eliminated and then there is a fall in the concentration. This is what happens. This is a plasma concentration time curve. हमेशा time जो है इसमें आपने इधर लेना है x axis में and plasma concentration that will be on the right, on the y axis. ठीक है? Now what we can derive from this plasma concentration time curve? We can derive three things. एक है आपकी ये peak. This is a C max. This is a one thing. So what is the C max? C max is the maximum concentration which is achieved. Then when this C max is achieved, that is T max. T max is at what time we have achieved the C max. Now another important is, now what about this part? This part tells what? This shaded area. This is the what which is going to tell how much drug it is absorbed. ये जो area है, this is going to tell how much drug that is absorbed. So this, how we are writing? Area under curve. तो कहीं पे भी आप AUC अगर देखते हो, if you see the AUC, then immediately just you immediately the thing which should come into your mind, that is they are asking about the bioavailability. Something is, we are related talking about the bioavailability. So from this plasma concentration time curve, the three things कौन सी हैं? एक Cmax, Tmax and AUC. Cmax, it tells about the safety of the drug, or maximum, it is the maximum concentration of the drug, it tells about the safety. Tmax is, it is going to tell about the rate of absorption, rather Cmax also rate of absorption. And AUC, that is area under curve, this is going to tell about the how much drug is absorbed or extent of the absorption, right? So now the bioavailability, what is the bioavailability? It is the rate at which and extent to which, it is a rate, पहले ये वाला लगाना, rate at which and extent to which the active concentration of the drug is achieved or is available, अब available word भी लगा लो, at the site of the action or in the systemic circulation. फिर से इसको बोलते हैं rate at which and extent to which the active concentration of the drug is available in the systemic circulation or in the plasma. Okay? Now what else we can derive from this bioavailability curve? So first is, okay, I will first take up the how we can calculate the bioavailability of any drug, any XYZ drug, how we can calculate. This is how this is a simple plasma concentration time curve from which we can derive the three things: Cmax, Tmax and area under curve. Now how to calculate the bioavailability of the drug? Just look at the next picture. This I have taken it from the Lippincott. So here what we have given the drug first by IV route, right? So you all know, if we give a drug by IV route, bioavailability, that will be the 100%. Here what we have done, we have taken a drug, first we give it by IV route, and then second we give the same drug with the desired route. मतलब वो हम किस route से उसको देनी हमने. Here I have given that drug with the oral route. पहले IV दी and then oral route. And then we have plotted this graph, plasma concentration versus time curve. For the blue color, that shows with the IV, and this red color graph, that is showing the area under curve with the oral route. And always remember, whenever you are drawing with the IV and oral, जितनी भी IV के साथ अगर ओरल नीचे वाला कोई भी रूट लो आप, रेक्टल लो, सबक्यूटेनियस लो, इंट्राडर्मल लो, कोई भी आप रूट लोगे, ये वाला कर्व हमेशा IV वाले रूट के से नीचे आएगा, इससे नीचे ही आएगा कभी इसके, क्यों? Why? Because bioavailability with the IV route, that is 100%. So उसके बाद हम इसमें क्या फॉर्मूला लगाएंगे? Area under curve with the oral route, area under curve with the IV route. So ये आपकी वैल्यू आएगी डेसिमल्स में, उस तरह से आएंगे. And if you want a value in percentage, then you multiply it with 100. So bioavailability, how we denote it? It is F. तो जहाँ पे बेटा F आता है, F stands for the fraction. The fraction of the drug which is available in the systemic circulation in unchanged form, that is a bioavailability. So ये वाले बेटा MCQ आते हैं. This may be asked in MBBS, this may be asked in the NEET PG entrance. So you must know, ऊपर आपने oral लिखना है, नीचे आपने IV लिखना है. अगर वो decimal में values दी हुई हैं तो उसको don't multiply it with 100. अगर वो परसेंटेज में दी हुई है तब उसको आप 100 से मल्टीप्लाई करके, बिकॉज इट विल बी गिवन एरिया अंडर कर्व विद द ओरल रूट इज लाइक दिस मच, एरिया अंडर कर्व विद द आईवी रूट इज दिस मच. यू हैव टू कैलकुलेट द बायोअवेलेबिलिटी. जस्ट पुटिंग दैट दोज वैल्यू इन दिस, you will get the bioavailability of that particular drug. You have to compare the same drug by giving first by IV route, then give it by the desired route, and then you have to write the formula एरिया अंडर कर्व, छोटा भी लिख सकते हैं, ओरल एरिया अंडर कर्व बाय आईवी रूट। अगर आपको नीचे जो चॉइसेस हैं, आपको कीज जो है उसके क्वेश्चन के एमसीक्यू में पॉइंट्स में दिए हैं, तो बस इतना लगाओ। अगर उसमें आपके परसेंटेज में, तब आप उसको मल्टीप्लाई करो 100 से, दिस यू विल बी गेटिंग इन अ परसेंटेज। ठीक है, सो दिस इज अ प्लाज्मा कंसंट्रेशन वर्सेस टाइम कर्व। तो इसमें हमें पहले क्या बताया था, हमें 3 चीजें मिलती हैं, एक तो ये सी मैक्स, टी मैक्स एंड एरिया अंडर कर्व। विद द एरिया अंडर कर्व दैट इज गोइंग टू टेल अबाउट द एक्सटेंट ऑफ द एब्जॉर्प्शन। ठीक है, whereas T max, C max, they are going to tell about the rate of absorption. Now what else we can see, why we can consider this, again I have taken from one of the standard textbook Tripathi. ठीक है, सो उसमें से मैंने ये वाली डायग्राम ली है बायोअवेलेबिलिटी की। सो हियर what this diagram it depicts, we use the two formulation of the same drug, let's say it's analgesic drug। ठीक है, कोई भी एनाल्जेसिक ड्रग ली है, उसकी 2 फॉर्मुलेशंस लिए हैं, फॉर्मुलेशन ए एंड बी। अब हमें ये देखना है कि विच वन इज टू बी गिवन टू द पेशेंट। ठीक है, वन इज फॉर्मुलेशन ए, फॉर्मुलेशन यू कैन सी दिस इज विद द ब्लू कलर, एंड फॉर्मुलेशन बी का ये उन्होंने डॉट डॉट वाला फॉर्मुलेशन बी दे हैव, एंड दे हैव शोन दिस सी मैक्स इसका और इसका, दे हैव शोन इट दिस वे, देन दे हैव शोन द टी मैक्स, ये मैंने बता दिया आपको, सी मैक्स, टी मैक्स एंड एरिया अंडर कर्व। Now, which one you are going to give to that particular patient? By looking at the graph, if you see the Cmax, the maximum concentration that is achieved very rapidly. If you look at the graph, ठीक है, very rapidly, कितनी जल्दी आ गया ये वाला। ठीक है, so we will prefer formulation A, but I will say no, it is not a formulation A. अगर मुझे कहा जाए, I will say कि मैं patient को B वाली दूंगी, this I will go for formulation B, not for the A। तो कोई पूछे क्या है, मैक्सिमम कंसंट्रेशन हो रही है इसकी, आपकी एरिया अंडर कर्व भी ठीक ठाक है, एवरीथिंग इज फाइन विद द फॉर्मुलेशन ए, देन व्हाई टू गो फॉर द फॉर्मुलेशन बी। अभी तक ये 3 कंसिडर किए, नाउ यू फोकस हियर मेनली ऑन द दिस, these 2 you have to focus this also, minimum effective concentration and minimum toxic concentration. These are the 2 important thing to be considered। एक ये और एक ये, इसमें आपने ये भी दोनों चीजें देखनी है। नाउ द सेफ्टी ऑफ द ड्रग दैट डिपेंड्स अपॉन द पीक कंसंट्रेशन ऑफ द ड्रग दैट इज टचिंग दिस और दिस। फिर से मैं रिपीट करती हूँ, द सेफ्टी ऑफ एनी ड्रग इट डिपेंड्स अपॉन whether the peak concentration this it is touching or near to the minimum toxic concentration or near to the minimum effective concentration। Here if I see the formulation A, इसकी peak यहाँ पे है, ये किसको टच करी, और ये this is above the toxic concentration and we don't want that, we want a effective concentration। So formulation B it is not touching, ये यहाँ पे खत्म हो जाती है, इसके यहाँ तक जा ही नहीं रही। ठीक है, so it is safe to use a formulation B, so I will go for formulation B। तो इस तरह के भी बेटा जो image based question है, that is also very commonly asked in a PG entrance, so just focus on that, simply looking at the C max and T max, if you answer we will give a formulation A because we are achieving आप हर किसी को होता है कि आपने दवाई दी वो उसी समय असर करे। ठीक है, but again the safety is a important factor when you are choosing a drug। So another important relative term related with the bioavailability, that is a bioequivalence। Now bioequivalence, just like a bioavailability, here also I will split the term, it is bio then equivalence। ये दो, जहां पे बेटा equivalence means equivalence ये equal, जब मैंने equal साइन लगा दिया कि ये इसके बराबर है कि नहीं है, that means I am comparing the 2 things। यहाँ पे हम किसको कंपेयर कर रहे हैं, we are comparing the brand of the 2 drugs, right? So in the previous I have done analgesic, अब जैसे analgesic, let's say take the salt paracetamol। ठीक है, example I will quote up the paracetamol। Now paracetamol, different manufacturer or brands they are available for the paracetamol, like Crocin is there। ठीक है, क्रोसिन है, आपकी कालपुल है, आपकी डोलो है, ऑल दे हैव अ पैरासीटामोल सॉल्ट इन दैट. पहले मैं एग्जांपल बता देती हूँ इसको, समझ लो. दोनों में एक्टिव सॉल्ट क्या है? पैरासीटामोल. एंड बोथ दे हैव अ सेम डोज. 500 टैबलेट फॉर्म में है, डोसेज फॉर्म उसकी सेम है, मतलब दे आर इन अ टैबलेट फॉर्म. सेकेंड थिंग इज अमाउंट भी उसकी सेम है, 500 मिलीग्राम क्रोसिन, 500 मिलीग्राम कैल्पोन. Now you have given this one. If you give this one to a patient, then suppose the plasma concentration achieved is 300 milligram, and with this the plasma concentration is 280 milligram. और you can say the bioavailability. अगर मैंने जब क्रोसिन दी 500 दी, जैसे पिछली एग्जाम्पल में क्या था, 100 मिलीग्राम जब दी तो सिस्टेमिक सर्कुलेशन में कितनी गई? 20. 80 किधर गई? 20 इनकम्प्लीट absorption from the intestine, and then 60 that undergoes a first pass metabolism. इसमें भी यही हुआ, वो 200 है, कहाँ पे गई? इनकम्प्लीट एब्जॉर्प्शन में एंड फर्स्ट पास मेटाबॉलिज्म में. इसमें क्या हुई? इसमें 220 मिलीग्राम, that is incomplete absorption and drug undergo first pass metabolism. Now bioavailability कालपोल की 280 है, इसकी 300 है. Now are they both, they are bioequivalent? अगर इसकी बायोअवेलेबिलिटी, इसकी बायोअवेलेबिलिटी, F डिनोट्स फॉर द बायोअवेलेबिलिटी, आर दे बायो इक्विवेलेंट? ये दोनों के दोनों बायो इक्विवेलेंट हैं कि नहीं है? या फिर अगर मैं इसको कर देती हूँ 240 और इफ आई से 320 और 340, मतलब इतना. Here question, my question is how much variation we can allow? कितनी वेरिएशन हो सकती है, कितनी वेरिएशन की हमारे पास गुंजाइश है विद दिस वैल्यू? इट इज प्लस माइनस 20%, दैट्स इट. अगर इससे ज़्यादा या इससे कम है, दैट मीन्स द ड्रग दे आर they are not biological equivalent, they are inequivalent or non-equivalent. They are biologically inequivalent or non-equivalent. If this values, this is another multiple choice question, if this is more than plus minus 20, then they are biologically non-equivalent. If the values is within this limit, then they are bioequivalent. So here 300, अगर ये 300 करता है, इसमें कितनी की गुंजाइश है? 280 to 320. अगर इसमें आता है देन वी कैन गो. अब ये बायो इक्विवेलेंट, ये टर्म आई कहाँ से? दिस is one unusual incident. It happened in the Australia in 1968 with the phenytoin toxicity. ये ऑस्ट्रेलिया में हुई थी बेटा with the phenytoin toxicity, and in 1971 it is with the digoxin. I'll take up the example of phenytoin. So phenytoin, what happened? There are the two preparation of the phenytoin. They are available. One is dilentine and other one is epotoin. ये दो आपकी preparation है, दोनों ही phenytoin में है. So what happened? Initially in the when we make a pharmaceutical company, when they make any tablet, apart from the active ingredient, there are many other things we have to put in a tablet, like coloring है. आप देखते हो tablet कोई नीले रंग की है, कोई पीले रंग की है, कोई तो that is they are going to put the color, and then all the molecules they should bind, so they put even binding agent also in that. Okay, so आपका coloring agent होता है, आपका binding agent होता है, and there are many other things they are also they have to put in that particular tablet. So in dilantin, one inert substance they had added, that is a calcium sulfate. Okay, this was added, but later on what happens, because this was not available, completely exhausted, so they thought this is just an inert substance. Why, if it is not there, we can add any other thing. So instead of the calcium sulfate, they added what they added a lactose. इसमें इन्होंने क्या डाल दिया? लैक्टोज डाल दिया. Now what happens with the lactose? Once a tablet with the lactose, once the patient took that one, what happened? It wetted very fast. So dissolution time was very less. The peak achieved earlier. peak concentration in the plasma achieved earlier with the apentine that resulted in phantoin toxicity. So that's why bioequivalence is whenever you are preparing any drug, like now presently, what is the current scenario about this bioequivalence? Now, if a pharmaceutical company is making any new drug of the original drug, so they have to see it new drug should be bioequivalent to the original drug, otherwise that drug will not be approved. So अभी presently क्या है bioequivalent का इतनी ज़्यादा it's not an weightage, because most of the drug different brand की अगर drug है mostly they are bioequivalent, biologically they are equivalent, non-equivalent nahi hai, but yes, still for the phantoin it is there. So when you are using a phantoin as an anti-epileptic, just stick to one brand. कोशिश करो आप उसकी जो ब्रांड है वो चेंज नहीं करो, ठीक है. So this is a bioequivalence अगर आपको आता है. So many different pharmaceuticals company they can manufacture the same compound. इसमें same compound में क्या है, dose भी same होगी, dosage form भी same होगी, ठीक है. Now the two drugs of different brand they are said to be bioequivalent if the difference in the bioavailability of the two preparation is less than 20 and inequivalent if it is more than 20. This is what I have just now I have told. So that's all about the bioavailability. Now what kind of question you will be getting? So usually in MBBS if you get a short note on this, ठीक है, अगर आपको इस पे short note आता है, how you are going to attempt this question on the short note or describe the bioavailability? First write the definition. आप दोनों लिख सकते हो, the rate at which or the extent to which the active drug is available in the plasma, that is a bioavailability, or it is a fraction of the drug, administered drug which is available in the plasma in unchanged form. What abbreviation we use it? We use F. Bioavailability of the various route, definitely with the IV route it is 100%, with the rest of the route you write it is a less than 100%. Now the two important factors, आपको ये इस two important factors, one is incomplete absorption and another one is yours, what is that, first pass metabolism. Now how we can calculate, then formula इसका क्या है, area under curve with the oral route, area under curve with the IV या जो भी with the IV route and then you multiply with the 100 अगर आपको परसेंटेज में निकालनी है. देन बायो इक्विवेलेंस, इस पे आप लिख दो बायोलॉजिकली इक्विवेलेंट और इन इक्विवेलेंट आपका है ±20%, अगर उसमें है तो ये है, इफ इट इज मोर देन दैट देन दे आर बायोलॉजिकली इन इक्विवेलेंट. नाउ फ्यू ऑफ द इंपॉर्टेंट MCQs. Bioavailability, the first choice is amount of the drug that reaches systemic circulation, drug metabolized in the liver before the drug reaches the systemic circulation, drug metabolized in the liver after the drug reaches the systemic circulation, maximum by rectal route. ठीक है, maximum by rectal route तो ये तो गलत हो गया, it is maximum by the IV route. नीचे से चलते हैं, ड्रग मेटाबोलाइज्ड इन द लिवर आफ्टर द ड्रग रीचेस. एक बार बेटा अगर ड्रग आपकी सिस्टेमिक सर्कुलेशन में आ गई, ये आपने इंटेस्टाइन से आपकी ड्रग हुई एब्जॉर्ब और ये आई आपकी ब्लड में सर्कुलेशन में आई आपकी, जैसे मैंने वो पहली एग्जांपल आपको दी थी ना कि कितनी आपकी गई, आपने इंटेस्टाइन में आपने ली 100 मिलीग्राम, 100 मिलीग्राम में से आपकी कितनी आई इधर क्या कहते हैं इन द सिस्टेमिक सर्कुलेशन 20. ठीक है, सो पोर्टल वेन में पहले यहाँ पे ड्रॉ कर लेते, पोर्टल वेन में 80, फिर उसके बाद आपका लीवर में आपका क्या हुआ, फर्स्ट पास मेटाबॉलिज्म 60 यहाँ पे आपकी लगी, एंड देन इन द systemic circulation it is only 20 milligram. If you can see the previous slide, so 20 milligram it is there. So drug metabolized in the liver after the drug, इसके बाद ये आपकी systemic circulation drug, अब यहाँ पे जब systemic circulation में आई है it is going to act on the site, different जाएगी आपकी जहाँ पे site of action, उसके बाद ये क्या होगी, even it get metabolized further in the liver. मेटाबोलाइज्ड इन द लिवर बिफोर, यहाँ पे पहुंचने से पहले जो यहाँ पे हुई इसको हम क्या बोलते हैं, नॉट द बायो, इसको हम क्या बोलते हैं, इसको हम बोलते हैं मेटाबॉलिज्म और बायो ट्रांसफॉर्मेशन. इसको हम क्या बोलते हैं, ड्रग मेटाबॉल, इट इज, इसको हम बोलते हैं फर्स्ट पास metabolism. So this is the right choice. The amount of the drug that reach into the systemic circulation, the correct choice is that. Then number 2, the causes of reduced bioavailability include high first pass metabolism, increased absorption, IV and high lipid solubility. अब हमने क्या लिखा है, reduce, कम कैसे होगी, हाई लिपिड सॉलिबिलिटी, तो ड्रग कैन क्रॉस इजिली, तो ज़्यादा हो जाएगा. IV से तो पहले हमें पता 100%. इंक्रीज एब्जॉर्प्शन हुई तो इंक्रीज होगी. तो इट इज़ अ फर्स्ट पास मेटाबॉलिज्म. रिमेंबर, फर्स्ट पास मेटाबॉलिज्म एंड हाई फर्स्ट पास मेटाबॉलिज्म. फर्स्ट पास मेटाबॉलिज्म we categorize a low first pass, intermediate and high first pass. So the same question, the causes of reduced bioavailability, answer is high first pass. This question may be asked in this way also. On which of the following factor the bioavailability of the drug depends upon? So remember दो फैक्टर आपके जो हैं, what are those two factor? Incomplete absorption number 1 and the second one is a first pass metabolism, right? तो ये दोनों के दोनों याद रखने. तो ऐसे आ सकता है आपको MCQ. Then what does plasma concentration versus time graph indicates? सीधा bioavailability. There should not be any other thought. ठीक है. अब ये वाला ग्राफ बेटा, इसमें ये है which formulation you are going to choose for the patient. सिंपल सी बात है. This side it is a plasma concentration and this side it is a time. We have a 3 formulation, A, B and C. ये 3 है, हमने ये 3 दी हैं. अब हम इसमें से पेशेंट को कौन सी देंगे, एक ही ड्रग के, C वाली पकड़ेंगे, B पकड़ेंगे कि A पकड़ेंगे. ठीक है. नाउ दिस इज, यहाँ पे क्या दिखाया है, यहाँ पे ये थेरापेटिक कंसंट्रेशन. इफ आई सी द C की बायोअवेलेबिलिटी देखो, बायोअवेलेबिलिटी वी कैन सी विद दिस. Wait, I'll use the same color. So area under curve with the C, it is a minimum. So that is a big no. इसको तो मैं दूंगी नहीं पेशेंट को, बायोअवेलेबिलिटी इतनी कम है and it is not even touching that. Then the second one is, if I take up the B formulation, see, it is just touching. इसमें अगर मैं, इसमें तो मैंने सीधा कह दिया C में कि एरिया अंडर कर्व दैट इज वेरी लेस. बट इफ आई टेक द फॉर्मुलेशन A एंड B, ठीक है, अगर मैं इसको लेती हूँ, इसमें लेती हूँ, तो एरिया अंडर कर्व दोनों को ऑलमोस्ट बराबर आएगा. एरिया अंडर कर्व बेटा क्या है आपका, हाफ इंटू बेस इंटू हाइट. दिस इज द फॉर्मूला वी यूज, हाफ इंटू बेस इंटू हाइट. तो B वाले में क्या है, B वाले में आपका जो बेस है वो ज़्यादा है, हाइट कम है बट बेस ज़्यादा है. A वाले में क्या है, A वाले में आपकी हाइट ज़्यादा है, बेस कम है. सो एरिया अंडर कर्व ऑलमोस्ट दोनों में हो सकता है, चांसेस अगर मैं कैलकुलेट करूँ तो बराबर आएगा. तो अगर इफ आई टेक अप द बायोअवेलेबिलिटी, सो बायोअवेलेबिलिटी ऑफ A एंड B मे बी सेम. सो कंफ्यूजन इज, मैं कौन सा दूं दोनों में. C का तो सीधा हो गया, उसकी बायोअवेलेबिलिटी है ही बहुत कम है, लेकिन आउट ऑफ A एंड B विच वन इज टू बी चूजन. सो इट इज A. Why A? Because B it is just touching. और ये बड़ा ऐसे जा रहा ग्राफ आपका, slowly it is absorbed and slowly it is eliminated. Whereas A, as soon as you have taken the peak plasma concentration that is achieved here, ठीक है, आपकी आ गई peak plasma concentration that is achieved and it is above the therapeutic concentration, right? So I will be choosing the A. That's all about the bioavailability. If you have any question regarding this topic, you can ask in the comment section. I would like to answer that question. See you in my next video. Thank you.